Hello, everyone. Thank you all so much for joining. Good morning or afternoon, wherever you're joining us from. My name is Danielle Augustine. I am a health education specialist in the Office on Women's Health within the Office of the Assistant Secretary for Health in the U.S. Department of Health and Human Services. I'm also the project lead for our Talking Postpartum Depression campaign. We're so excited to have you all here with us today to talk about how you all can implement the Talking Postpartum Depression campaign in your own community. A few housekeeping items related to Zoom before we kick off. If you have a question for myself or any of the other panelists, please feel free to use the Q&A feature at the bottom of your Zoom window. The chat feature is also enabled that will come to us as hosts and panelists if you're having any technical issues. Auto transcription is enabled, so if you would like to enable captions, please feel free to click the CC icon at the bottom of your Zoom window. And lastly, this webinar is being recorded and will be sent out to all participants at the conclusion of the event. So to set the stage a little bit, we know that current estimates for PPD from the CDC report that 13.4% of women reports experiencing symptoms of postpartum depression in the year following childbirth. And we also know, as is the case with many other mental health conditions, these numbers are largely underreported due to barriers like stigma and barriers in screening. So these numbers are likely higher than what is captured here. This campaign specifically aims to meet a goal that is outlined in the White House blueprint for addressing the maternal health crisis, which is to reduce the stigma of postpartum depression and other behavioral health conditions through a media campaign to raise awareness about PPD. So we wanted to give you all a little bit of background around the campaign and why we're focusing specifically on postpartum depression. Planning for this campaign began over 5 years ago, which we know the world has changed a lot in the last 5 years. So our aim when planning this campaign was to clarify some areas of confusion that we identified around postpartum depression. So first, we understood that there were misconceptions and stigma associated with a depression diagnosis, which often interfered with an open conversation about the topic, particularly between women and their healthcare professionals. We also noted that there was and continues to be confusion around the difference between baby blues, which many women experience in the days following birth, and the symptoms of postpartum depression. And lastly, there was some confusion around the difference between postpartum depression with another mental health condition called postpartum psychosis. So our primary goal was to provide some clarity around these areas of confusion through our communication and resources. We want you all to know that our team is very aware that there are other maternal mental health considerations beyond depression, like postpartum anxiety and postpartum psychosis. So we have made sure that in our calls to action in the campaign, we've included links and resources that provide a wide range of information and assistance that speak to these additional maternal mental health conditions, like the maternal mental health hotline, postpartum support international resources, and the 988 suicide and crisis hotline. So our hope is that by better understanding PPD through this campaign and reducing the stigma, we can then set the foundation for expanded work in the areas of maternal mental health to continue to build and reach these other areas. So our campaign charge specifically is to empower women to seek help by destigmatizing PPD through increased awareness of PPD symptoms, visibility of reliable resources, and understanding of ways to access care. Our primary target audience are U.S. mothers aged 18 to 44. We have tried to put a particular emphasis on reaching the groups that are most at risk for developing postpartum depression. And this is highlighted throughout the tailored messaging that we have, as well as the women with lived experience that are highlighted throughout the campaign. So some of these risk factors include women of racial and ethnic minority groups, women who have a personal or family history of depression, women who have had a difficult or traumatic birth, women who have had babies that required an extended NICU stay or have special healthcare needs. So again, we have tried to make sure that these groups are we're being particularly mindful of these groups of individuals. We do have a set of secondary audiences, which we deem in a lot of our resources as the supporters. So family members, friends, other support networks, and healthcare professionals. So as we go through our campaign toolkit, we want to preview these resources with you all. Our toolkit and all of the campaign materials can be reached at womenshealth.gov/talkingppd, and this particularly is /toolkit. So when developing our campaign messaging and toolkit resources, we did a number of surveys, focus groups, individual interviews, and message testing, reaching over 2,000 women to gain their input. So we have made extra sure that our resources are culturally competent, speak to the unique barriers and nuances that many women experience, and making sure that women can identify with the messaging that is presented throughout the campaign. So at the core of our campaign, we have lived experience through video testimonials. We have 5 different women who have shared their personal stories with us. And each of these are around 4 to 5 minutes long. These are called our full-length videos on our website. We also do have a roundtable discussion where all of the 5 women are engaging in a really powerful conversation with each other that is facilitated by a moderator. We also have all of these videos in short form cut downs that are 30 seconds in length that can be used across social media in a more user-friendly way. We also do have what we're calling a women's gallery, which has additional testimonials of lived experience of diverse women that is in written format. And we have 4 currently on the website, but we are planning throughout the length of the campaign to continue to gather and highlight stories. So we'll have many, many more over the course of the campaign. We have 6 downloadable campaign graphics with associated sample social media verbiage. And then we have 11 educational and outreach documents that are printable and downloadable. So at this point, I am going to share the website with you all and walk through some of the resources. So this is our main campaign landing page. It is, again, womenshealth.gov/talkingppd. So on the main campaign landing page, and I'll try to scroll semi-slowly, not to make you all motion sick, but we have highlighted at the very top those personal stories of the women with lived experience, because again, their voices are at the core of our campaign. Below that, we have our women's gallery. And so we have, as I said, 4 women right now that have shared their stories, and these are all highlighted throughout here in written format. These will continue to be added to. On the left-hand navigation here, you'll have a page that you can navigate to specifically for finding support for postpartum depression, if you just want to learn more about the campaign in general. And then we have our toolkit, which I'll go through here now. We have all of the women's stories linked. These are all going to link out to our YouTube channel. And so we have the full-length videos, the 30-second previews, and the mobile-friendly views as well. And I'm actually going to reshare so you all can hear my sound. I want to preview one of the videos with you all.
When I finally had my little prize there, like I didn't feel like I had my little prize. I felt a disconnect emotion-wise, and I felt fear. It was just hard to admit to myself, even harder to admit to somebody else, and to speak the words like, you know what, I think something's wrong. I'm not perfect, but I am very much closer to where I want to be, and I'm happy about it. There are people out there that will help you, and you just have to look for it.
So we highly encourage you all to watch the women's stories, especially the full-length videos. If you have 4 or 5 minutes to spare, they are incredibly powerful. And again, really speak to the angle that we're hoping to go with highlighting lived experience throughout the campaign. And if at any point my team, I know I'm clicking between screens, so if you can't see or hear me, just give me a shout and I'll adjust because I can't see you all. So below the personal stories, we have our social media messages. And so these are all downloadable graphics that you can use. And I forgot to say at the jump of this, all of these resources are free on our website to download and use. They're all copyright free, and citation is not required, but always appreciated. So these resources, all of these graphics are downloadable, and then accompanying all of them, we have a sample social media post that you can take and use. By no means do you have to use this exact verbiage. Feel free to take what's there and tailor it and make it your own. So one resource for every one of the stories, as well as a general campaign graphic. Below that, we have our robust list of our digital and print resources. And so all of these are downloadable, and all of them also have a Spanish version that is downloadable as well. All of the resources as well have Spanish captioning that is available on YouTube. So I'm going to go through each of these resources briefly just to give you an idea of the resources that we currently have available. First and foremost, we have our general postpartum depression fact sheet for women and their support networks. This provides a general overview of what PPD is, what are the signs and symptoms, what are the risk factors associated with PPD, treatment options if an individual is at that stage where they're exploring treatment options, and then some sort of at-home self-care options as well. You will see that the main call to action on all of our resources is pointing folks in the direction of HRSA, or the Health Resources and Service Administration's National Maternal Mental Health Hotline, which we'll talk about here a little bit. But you will see, in addition to our website for the campaign, you'll see the hotline as a key call to action on all of the resources. And this is an example of a Spanish version that we have for all of the resources. Next, we have just our sort of PPD resource quick sheet. So this is a quick one-pager that has the key websites and phone numbers on them, as well as some ways to point folks in the direction if they're looking for a local support group or they're looking for a community organization, some tips and tricks about how they can start to make those local connections, as well as Postpartum Support International and their helpline. We have tips for talking with your healthcare professional about postpartum depression, knowing that this is a major barrier for a lot of women is they don't know how to, or they feel scared to come forward and talk about the symptoms that they're experiencing. So in this document, we provide them some resources and tips for preparing for the appointment, some information regarding bringing a friend or relative for support, the importance of being honest. We've put all of the general PPD symptoms in sort of a checklist here so that a woman can look at this and bring this exact sheet to her doctor's office if she would like to help her explain the symptoms that she may be experiencing. The importance of asking questions and being an advocate for yourself and your treatment options. And then lastly, some additional resources for preparation. We have a long form guide to identifying support for postpartum depression. So this might be used for women who are at the stage where they know that they want to get support and they want some tangible next steps. So we provide some information about finding support, some people in your life that you may be able to identify and things that they may be able to support with. The importance of creating a home team and what we also call a community team. So home-based and personal resources, but then also community-based resources. Potential treatment options when looking for professional help, as well as how, next steps in ways that folks can go to find a professional help if that is what they are seeking, and then some additional self-care strategies. This is a short form version of the resource that we just looked at, so just more of a quick guide for identifying support with some of those highlights. We have this resource specifically for if you are an individual that is supporting someone with postpartum depression, you are a loved one who is concerned. So this resource provides a quick overview of postpartum depression, because we know that that's a really difficult place to be in, is if your loved one is struggling, how do you approach that conversation? So we have the resources, a description of postpartum depression, along with some tips about how to learn about PPD on your own, how to listen and start the conversation with someone in your life who you think may be struggling, how to create a supportive environment, and then additional resources to support that individual if they are seeking help. This resource specifically is for professionals. So for any mental health or healthcare professional, an overview of postpartum depression, some action steps that they can take to learn more about PPD to support their patients and clients, and then a whole host of resources that are geared specifically for healthcare professionals. We have what we're calling our postcard or our palm card. So if you were to print this out, it would be smaller in size, so really easy to throw into a folder or add to a packet of resources. That just gives a quick overview of PPD, our campaign, and some of the signs and symptoms. We do also have a sample PowerPoint slide for you all. So if you're giving any sort of presentation around maternal mental health or postpartum depression and you want to highlight the campaign, by all means, please feel free to use the into your PowerPoint. We also have an example of this item. So if you would like a resource for exam room, this is created with the dimensions of a poster. So below our print and digital resources, we have just, again, some of those key resources that we've been highlighting throughout. So the Suicide and Crisis Hotline, the Maternal Mental Health Hotline, and the Postpartum Support International resources, as well as our contact information. At this point, I'm going to switch back to our PowerPoint, and I do see Dawn on here. So at this point, I'm super excited. I've mentioned the maternal health hotline to you all. That is our key call to action, knowing that we have an awareness campaign and we want to increase understanding of PPD symptoms and reliable resources. And we're so happy to be working with HRSA as that sort of action step. So at this point, I'll share my screen and then turn it over to Dawn.
Danielle, thank you so much. Can you hear me okay?
Yes.
Okay, great. Thank you. Well, good afternoon or good morning, depending on your time zone. My name is Dawn Levinson. I'm the Deputy Director in the Division of Healthy Start and Perinatal Services in the Maternal and Child Health Bureau, or MCHB. MCHB is part of the Health Resources and Services Administration. HRSA works across diverse populations, serving everyone from infants to the elderly to ensure access to a broad range of primary care and public health services, especially for people who are geographically isolated and economically or medically vulnerable. And our mission here at HRSA is to improve health outcomes and address health disparities through access to quality services, a skilled workforce, and innovative high-value programs. Today, I'm here to speak with you about the National Maternal Mental Health Hotline as a critical resource for connecting pregnant and new moms to immediate support and referrals to access mental health care providers and supports in their communities. We want to thank the HHS Office on Women's Health for the invitation and the partnership to help promote the hotline. We could get the next slide, please. So HRSA officially launched the National Maternal Mental Health Hotline on Mother's Day last year in 2022. We were delighted to celebrate the hotline's first anniversary on Mother's Day this year. Congress authorized the first ever National Maternal Mental Health Hotline in the Consolidated Appropriations Act of 2021. So what does the hotline offer? The hotline service is available 24/7, 365 days a year, and provides free, confidential, emotional support, information, and referrals to any pregnant and postpartum mothers facing mental health challenges and their loved ones. Professional counselors staff the hotline, and they provide support in English and Spanish via telephone and text so that people can get the help they need when they need it. Interpreter services are available in 60 additional languages, and a relay service is available for those who are deaf or hard of hearing. These resources really expand our ability to reach diverse populations who need this specified support. The hotline number is easy to remember and dial 1-833-TLC-MAMA. And I did mention there's a TTY relay service for those who are hard of hearing. We do note that the National Maternal Mental Health Hotline is not intended as an emergency response line. So individuals who are in imminent danger of harm to themselves or others should call 911, and individuals in behavioral health crisis should continue to contact the National Suicide and Crisis Lifeline at 988. It is important to note, though, there is a connection already established between our hotline and 988, and our hotline counselors can make a warm line transfer to 988, as well as to the National Domestic Violence Hotline and the Disaster Distress Hotline if needed. So you've already heard from Danielle about some of the key statistics and why we need a 24/7 resource like the hotline. But I do want to emphasize that depression during and after pregnancy, up to 12 months after delivery, is one of the most common medical complications of pregnancy and childbirth. And undetected and untreated, these conditions are associated with poor maternal and infant bonding, decreased breastfeeding initiation, and delayed infant development. And of course, looking at the last couple of years, stressors of the COVID-19 pandemic had exacerbated symptoms of depression, anxiety, post-traumatic stress, and loneliness reported among pregnant and postpartum women. But because maternal mental health conditions are common and treatable, when identified early and people get connected to evidence-based treatment and supports, they can get better. So I want to tell you what can I expect when I contact the hotline? So here's a little Q&A for you. So parents and families who contact the hotline will speak to professional counselors. Counselors will immediately provide real-time emotional support. They'll provide evidence-based information and resources like virtual support groups. Counselors also will provide referrals to local or telehealth providers with expertise in perinatal mental health. So if callers or texters need long-term care and support, the counselors can tap into their extensive provider database. So who do you speak to when you call or text? Hotline counselors are maternal and child health professionals. This includes licensed mental health clinicians, licensed healthcare providers like nurses or doctors, certified doulas or childbirth educators, and certified peer support specialists. Counselors also have training in how to provide culturally appropriate and trauma-informed support. When providing referrals, they also take into consideration the caller's preferences for age, gender, ethnicity, language-specific resources, and a person's insurance. It was actually a built-in HRSA requirement of the hotline that they hire counselors who reflect the diversity of help seekers across the US, including racial, ethnic, age, sexual orientation, gender identity, and geographic diversity. So what languages do the counselors speak? Well, I did mention English and Spanish, and then I also mentioned the interpreter services in more than 60 languages. And I want to note that the fact that we have this vast translation service is really important for everyone to know: public health professionals, primary care, social service providers. So when you're making referrals to the hotline, this translation service increases access to immediate help and emotional support for so many diverse pregnant and postpartum people and their loved ones. And specifically for your states and communities that serve diverse populations, please help us spread the word about this accessibility. So if we can go to the next slide, please. So this slide documents contact volume for our first year. But to date, the hotline's professional counselors have conducted more than 21,000 conversations as of the end of September. And that's about 70% of contacts by phone and 30% by text. The next several slides cover some of the key metrics. At 1 year, the average speed to answer was less than 30 seconds. But of course, this can fluctuate as contact volume increases. Next slide, please. As for who uses the hotline, the majority of individuals contacting the hotline were seeking help for themselves, so 76%. Then 6% of individuals were calling on behalf of someone else, like a family member or a friend. 5% said they were providers, contacting on behalf of a client or requesting information about the hotline. And then looking at the call out pie chart, among the people who said they were calling for themselves, more reported reaching out in the postpartum period versus those who are pregnant, so 41 versus 22%. And among those who were calling for themselves, but were not pregnant or postpartum, 9% reported being a partner or caregiver seeking support. So the hotline is accessible to not just the mom, but also family members and others who care about her. Last slide, please. Or next slide, please. So what are the top reasons for calling the hotline? Why do people contact? People may call the hotline for more than one reason. And the top 5 reasons, not surprisingly, are depression, anxiety, feeling overwhelmed, issues related to pregnancy, and relationship conflict. And because some people called for more than one reason, these percentages add up to more than 100. Go to the next slide, please. So how can you learn more about the hotline, help us promote the hotline, in addition to the fact that this is an important call to action for those of you who are using the PPD materials that Danielle just spoke about. So for us, currently, we have an ongoing organic social media campaign, and we recently launched a paid social media campaign with more to come in the coming year. Folks want to know how we marketed the hotline, and after we launched last May, HRSA engaged in partner outreach to more than 100 provider associations, national organizations, nonprofits, and federal partners to promote the hotline to their constituents. You can also visit the hotline website and download or order promotional material to share with your clients, providers, birthing hospitals, community-based and faith-based organizations, early childhood providers, and any other partners who serve new moms and young families. At the website, we have a partner toolkit with downloadable and print promotional materials in English and Spanish. The materials include flyers, wallet cards, posters, magnets, newsletter texts for partners, and social media graphics and messages for organizations to share with their networks. We do want to note that while you can order a limited supply of posters, wallet cards, and magnets on our website, you can also print your own or use the print files available to bring to local, or you can also use files and you can bring them to a local or online vendor for the mass print quantities that you may need. While we would love to be able to provide an unlimited supply, please understand our resources are limited. In closing, the more people that understand that perinatal depression and anxiety are common and treatable health conditions, the more they'll reach out for help, and the less they and their families will suffer. So the last slide, thank you. The last slide is my contact information. And the final slide, please, is connect with HRSA. HRSA is on these social media platforms. So please connect with us. And thank you again for having us.
Thank you so much, Dawn. And again, we're just so grateful for this partnership and being able to collaborate in this way to sort of from beginning to end, make sure women get the services that they need. So Dawn, there are a couple of questions for you, but we'll come back to it in the Q&A portion if that's okay with you. So next, we want to move forward into talking about how you can actually utilize the campaign materials for the Talking Postpartum Depression campaign. A major question that we get is simply, how do I participate in the campaign? And the biggest takeaway is to share the messages with your communities. We by no means want to make any part of this campaign the additional work that you put on your plate. We know everybody is incredibly busy. And so we hope that the campaign materials can be integrated into your existing work. So please feel free to use these resources as a supplement to your existing maternal mental health work or maternal health work in general. So an examples would be that if you want to show our videos as the beginning of a roundtable discussion or community conversations or support groups, we know that hearing from others with lived experience really does do wonders to decrease the stigma and encourage other people to come forth. So any sort of conversation starter that you're hoping to have around maternal health or maternal mental health, the videos are a great place to start with those. We want to empower you all also to use what works and resonates with your communities. You all know your communities best, and you all know what needs that they have more than we do. So any topic that is particularly outlined in any of the resources, if any story resonates with your community or an individual, and any of the women in the videos, knowing that it's important for people to see themselves in media. That's an important way that folks can make connections to their own personal experience. So we very much encourage you all to use what works and to leave what doesn't. Tailor it to your audience and your audience's need. You all are the trusted sources in your communities. We fully recognize that we are at the federal level and this is a national campaign. And we want to make sure that the ways that we get the resources into the hands of the women and the families that need it, we know that we can't do that without folks like you all who are the boots on the ground, who are the trusted sources in your community. And so we encourage you to get creative in the way that you use the resources. We don't have to be the end all be all with these maternal mental health resources. I think, Dawn's efforts are a great example of how we have been able to amplify existing resources that are already out there, and they're very meaningful, impactful resources. So, we point to things like the maternal mental health hotline. We know that Postpartum Support International has a ton of great resources for folks that are in that support network umbrella. So wherever possible, we point to existing maternal mental health resources throughout. And so we encourage you all to take that same approach and to incorporate what makes sense and pull from as many sources as makes sense to you all to effectively engage with your communities. A great first step is to just simply think about who would benefit from these resources. So our target audience is, of course, women and families, but it doesn't have to stop there. So some additional maternal health professionals like doulas, midwives, like lactation consultants, mental health professionals, community health workers are an awesome way to get resources into the hands of community members from a trusted source. Students are a great avenue as well for something like PPD, which is often not covered in a lot of curriculum in depth for things like pre-med, med students, students in other allied health professional programs. These are great resources for education as people are on their journey as a student in their field. Community resource centers are also a great place. We know that they're always looking for resources to be able to point their constituents and their community members to. We have tried to make sure from the jump that these resources are fully accessible in as many ways as possible and culturally competent. And so we have made sure to be very mindful of using plain language as much as possible in the resources, being mindful of the reading level so that these can be reached by the broadest audience possible. As stated, we also have the resources, the print resources available in Spanish, as well as the video captioning. And we hope to be able to continue to identify the needs of diverse audiences so that we can tailor the resources to meet their needs. So at this point, I want to turn it over to another individual who has been integral in the success of this program in the campaign. Reverend Dr. Q English is the director for the Center for Faith-Based and Neighborhood Partnerships, often referred to as the Partnership Center at HHS. And so Dr. English is going to take time to talk about a really great opportunity that the Partnership Center has put in place called the Moms Tour. And this is a shining example of ways that our resources from the PPD campaign and resources like the Maternal Mental Health Hotline from HRSA can be incorporated into these existing efforts. So Dr. English, I will turn it over to you.
Thank you, Danielle, and thank you, the Office of Women's Health. Thank you for taking the time just to pull all of these elements together, turnkey, being able to share simple language and extremely effective. So first and foremost, as she mentioned, I direct the Center for Faith-Based and Neighborhood Partnerships here at HHS, and we have 5 core initiatives. One is substance use disorder, inclusive of overdose prevention. We have created a toolkit for substance use disorder for the faith and non-faith community. We also focus on youth and mental health. We all know the stats there, as the Surgeon General has declared a national emergency for youth mental health in 2021. We prepared a toolkit there for those that are interested, and we can definitely share that with you after my discussion here, remarks here today. We also focus on suicide prevention. We did a suicide prevention toolkit in partnership with SAMHSA and with the National Faith Alliance, specifically for youth, and it's called HOPE. and that is also available. We've created 3 PSAs with the trusted messengers, whom I call trusted messengers, and many of us on this line call trusted messengers, and that is the faith community, to talk about suicide prevention, to talk about their lived experience, and then to point them to another resource, which is 988. We have created that for the African American community, the Hindu community, the Muslim community, and we're about to release one for the Spanish-speaking community, followed by youth and the Asian community. And so these are some of the things we're working on. And pertinent to this call, we're also, as a final focus area, is maternal health. You know, we all know that the U.S. has the highest maternal mortality rate than any developed nation in the world. So our aim is to see the U.S. become one of the safest places for women to give birth. And I know we all share that here today. And so as I thought about, when I heard about the rollout of this toolkit, and I thought about, and to Danielle's point, where can we integrate this in the work that we're already doing? And the obvious connection for us was to bring it on the road with us, so to speak, on the Moms Tour. And the Moms Tour is the Maternal Outcomes Matter Shower. And it's a national tour that we're doing in areas that have been identified with high maternal and mortality rates. And the focus there is to connect pregnant and postpartum women real time to the resources that they need, whether it would be for healthcare coverage, and in this case, mental health, competent services for mental health, lactation services, to our Healthy Start programs on the ground that are doing incredible work that have been funded by HRSA. So what we're creating is what we call a village, the village that many of these pregnant women and moms didn't even know, pregnant women and postpartum women didn't even know existed. And so for us, it is an extreme easy lift to think about how do we incorporate this toolkit. So what we've done, because we give out to everyone that attend a resource guide, so to speak, or a resource document, we easily incorporated this in the resource document. We included it as part of our QR code. After the event is over, we actually send it to them electronically. So they're getting it that way. Not only are we sharing it with our prenatal and postpartum mom, but we also are sharing this with our exhibitors, those that are there that can also include this as part of their talking points. When we have our panel discussion, this is now automatically part of our bullet points that we will cover, and letting those that are attending know that this is being offered. So the other ways we're doing this is we think about our faith community, the trusted messengers who have right within their congregation pregnant and postpartum moms, women. And so it's an easy lift for them to be able to share this resource through their social media platform, through bulletin announcement, through pulpit announcement. And how do we do that? We craft the message for them, because they don't have to do a deep dive in learning everything about that, right? About this toolkit, but they can stand up behind a podium and make an announcement. They can show a video for those that have the capability to their congregation members. And lastly, they can include something that's already been pre-printed quite easily inside of their bulletin. So what we do here at the Partnership Center, once we know that it fits within something that we're already doing, we start brainstorming. What are the ways we can amplify this postpartum depression toolkit? And that's what we've been doing. And we've already shared it on 3 legs so far, which is of our tour, which has been Dallas, Houston, and forgive me because I've been in so many cities, another city right after that. So we've already shared it on 3 legs of our tour. We're going to Chicago tomorrow on this Saturday, so we'll be able to share it then. And then we have other cities that we're going to, namely Tulsa, Oklahoma City, We're going to, in partnership with Senator Warnock, we'll be in Atlanta. We're going to Puerto Rico, and then we're going to culminate right here in the DMV area in Prince George's County. And so I invite you, if you have an interest, to participate and to collaborate. Please reach out to us directly at HHHS Partnerships as a Twitter, but you can reach out to us via email at partnerships@hhs.gov. That's partnerships@hhs.gov. Danielle, I just remembered that last city, Little Rock. We just left Little Rock, Arkansas, and was able to amplify the toolkit there. So again, just thinking of creative ways. These are needed messages. This is a needed toolkit, an important piece for these women to have in their arsenal, as well as these direct service providers, so they too can share it. So I really wanted to just encourage everyone to really think through how you can amplify it, as the Partnership Center has. Thank you, Danielle.
Thank you so much, Dr. English. And again, just such a shining example of ways to incorporate the resources and get it into the hands of the women and families that need it to most. And just kudos on this amazing effort. I mean, the tour sounds amazing, and there's lots of people that are interested in the chat. So thank you so much for sharing. Lastly, before we turn it over to questions, I want to let you all know where we're going with this campaign and ways that we can continue to work together. I don't think I have said this yet, and I apologize. This is a year-long campaign. We launched in September of 2023, and this runs through September of 2024. So this is not a one-and-done situation. This is not a set-it-and-forget-it campaign. We are actively partnering, collaborating, and implementing the campaign over the next year. And so we'll support, monitor, and adjust it based on the feedback and the needs that we hear exists. So we're working with our federal partners and collaborating organizations to assess the uptake, reactions, and efficacy of the campaign assets, to then identify gaps, needed resources, and potential next steps for collaborative initiatives. So some areas that we have already started exploring as potential focus areas for additional resources are focusing on women who are veterans, women who have experienced infant loss or miscarriage, families that have adoptions, young or teen mothers, immigrant and refugee populations, and then screening and education for providers. So please, if you've ever been on a call with me talking about this campaign, you've heard me say this before, and I'll say it again, we want to hear your feedback. We want there to be open lines of communication because, again, you all are the trusted sources in the communities. You know your community members best, and you have that ability to have dialogue about where are the gaps and what additional resources are needed. So please feel free to continue to have conversation with our team if you have questions about any of the resources or how you can implement them, and any feedback that you're receiving of, I hosted this community coalition event, and they expressed a need for a resource that focuses on infant loss, anything of that nature, please bring to us so that we can tailor and create additional messaging and resources throughout the next year. So at this point, we actually have a few minutes. I'm going to share one of the full-length videos with you all before we turn to question and answer, because it is so incredibly powerful. So I'm going to cue that up on YouTube right now. And please feel free in the meantime to pop any questions that you have in the chat. We will go through those here and use the rest of the time to answer any questions that you all have for myself, for Dawn, or for Dr. English.
Treatment doesn't just save lives. It can lead to happier, healthier families too.
When I first had my daughter, it was like new mom anxiety. I would go to doctors and whatnot, but they were just brushing it off. I wasn't properly diagnosed until I was like 8 or 9 months out. Every cry, every moment, I wanted to be there for her. I'm Allison. I have a 4-year-old daughter, and I'm 32 weeks, and it's a boy. I was aware that postpartum depression can happen. I wasn't told like details or anything. I just knew that you might be really sad for a period of time. You'll have crying spells, and your hormones really contribute to it. That's about all I knew about postpartum depression. I mean, you bring this life, new life, and then you want to keep it alive. You don't know what to do. You're just kind of thrown into this situation. And it's a shock to you, your hormones, everything. And then you're trying to navigate what to do. So you're always on. I was having intrusive or scary thoughts. So I was having thoughts around harm, which is really common actually in postpartum depression. I knew something was off when I had my really dark, anxious moment that I thought I had killed my daughter when she rolled off of me and was asleep in the bed. I woke up my husband and I told him, we have to give her away. If anything happens to her, I will take my life. I can't do this anymore. I think when I finally got treatment, I was able to really categorize. I was having new mom anxiety. I was able to bring it down. And then I was able to give trust and like let go of the little things that I was so anxious about prior. I would avoid going anywhere, doing anything. I mean, I had family, I had cousins, I had my aunt, I had my mom. I had all these invitations, but I literally refused. I was just too anxious. So I think being able to go out and away from my daughter to like get my hair done or being away from her for 2 to 3 hours, trusting somebody else could watch her and be with her and me not checking on the monitor was such a great step for me. It was medication, it was also therapy, and it was just slowly taking the steps and working through to get better, to heal. I had all these resources. I have support now. I have a great group of moms. I have family, etc. And that gave me the courage to try again. Here we are. I do have my anxious moments. I still take medication to this day. I still have a therapist. But I know that I need those tools in order to be okay and to get better. I've learned that you can be sick, but you can also get well. Healing doesn't look like a one and done situation. It's a journey. They say like mental health is like this totally different thing than physical health, but it's not. It's the same. I want it to be known and that OBs and doctors and parents and everyone just be like, oh, that's a thing. You have postpartum depression, and then working through it. What I want others to know is that you are still on that path. Like you are still recovering. It's just how you handle it. I was there. I was with you. I was the one staying up until 3 or 4 a.m. just rocking my baby, crying with my baby. But it will get better. Women have you. We got you. You got to speak out. I know it's scary. I know you don't want to, but part of this is just the first step to get better.
Talking can lead to healing. Call or text the National Maternal Mental Health Hotline at 1-833.
Thank you all for giving us the time to share that video. It's just, again, so powerful, and 5 different women share an experience and share it in a similar format to Allison. So we encourage you all to go on the website, watch the videos and share them broadly. So at this time, we are going to transition over to our Q&A section. So again, feel free, any questions that you have for myself, Dr. Q English, or Dawn, we are here and happy to answer any questions that you have. And I think Michelle is helping us to facilitate this portion. Dawn, someone had asked during your presentation, is there a way for folks to see or understand the resources in their local area that the hotline is referring to, or how does that work?
Great question. Yes, what I can do is I can drop into the link. There is the provider directory is listed online. It's currently on the website of our hotline contractor, which is the organization Postpartum Support International, which has already been mentioned as an important resource for the field. So I can drop that in, and then folks can search that online directory. I also wanted to clarify, I know there was a question about how can providers partner or perhaps even be included amongst the hotline directory. And one of your colleagues here chatted in contact information for the hotline project lead, Christina Talley, here at MCHB. And also we included the email address for the hotline for interested providers who want to learn more about how they might be eligible to be listed in the provider directory. All the providers in the hotlines directory are certified in perinatal mental health specialty. And so you can reach out to them as well. Did I
Thank
answer
you so
the
much.
question? Okay.
Yes, absolutely.
Okay.
And for folks asking in the chat, we will follow up with the recording, with the slides, and for contact information and any links that were mentioned on here today. So if you missed part of it or didn't quite get your pen quick enough, you will definitely have that. Dr. English, there are just questions for folks that are really interested in the tour and wondering, what your plans are if it's coming to a city near them. How can folks maybe potentially jump on that amazing train that
I'm going to actually send them our in-house contact person's email. If you are interested in being a part of the tour in any way, helping to amplify it, to promote it, etc., or even participate in it based on your field of expertise. Our panel discussion includes the doula, includes the midwife. Again, it's about connecting them to services that they didn't even know existed. It includes an OBGYN. We're looking at a holistic model of care, and it includes a mental health provider. So if you're interested in being a part of that, or you want to be a part of the planning, if you want to attend, or if you want to get your moms to that event that you're servicing, I would absolutely welcome you to do that. So I'm going to share in the chat the email that you should use for Dr. Hunt, Dr. Coraline Hunt, who now is having this as part of her portfolio. So I will share her contact information in the chat. But we definitely welcome you.
So there are a couple questions in the chat regarding different demographics that are questions that are being highlighted. So I see a question about Native American specific information, or women who have experienced infant loss and are in the grief process, and how that connects with postpartum depression. And I want to just reiterate, those are all topics and considerations that we are planning for sort of our next steps of the campaign, if you will. So through the gallery specifically, those are those written testimonials. We are capturing as diverse and broad of an audience as possible there. So women who are Native American, women Alaska Natives, women who have disabilities, making sure that we are having as many different voices represented there, people who identify as LGBTQ, because again, it's important for people to see themselves in stories and to resonate with someone's experience. That really helps encourage women and people to feel empowered to come forward and seek help. So all of those considerations are on our radar. But please continue to let us know any resources that you have that we can potentially tap into, or additional areas that, like I said, that your communities have identified that there is a need for. I see another question about teen mothers. That's another area that we are hoping to reach with some additional supports as well. Oh, and thank you, Dr. English, for popping that stuff there in the chat.
Mm-hmm.
Dawn, can you point folks again to the page where there's like the downloadable and orderable resources and how that process works?
Sure. Oh, yes. Sorry, I did say yes. I will chat that in regarding the link to the partner toolkit, where folks can download materials that they can print or that they can order to print.
Awesome. Michelle, any other questions? Sorry, I'm trying to run through them quickly, but any that you want to highlight for the group, please feel free. I see a good question about partnering with state, local, regional perinatal quality collaboratives to promote the campaign. Yeah, so that's the stage that we are at. We again launched a month ago. I feel like we have made connections on the federal level, but we are sort of in a funnel approach, making our way down. We have our regional women's health analysts that are part of our office, who are helping us make connections in the regional level, then trickling down to the state local and community level. So again, we are working hard on our end to make those connections, but of course, encouraging anyone to reach out to us as well if they're interested in collaborating in any way. Dawn, is there any information about times of year maybe that you see additional traffic coming to the hotline?
So the hotline has been in operation now about a year and 9 months, not even, about a year and a half. And so at this point, I can't really comment on that kind of, tracking. But what I can say is we have seen an uptick in contact volume during the time in which we see perhaps incidents in the news, tragic incidents in the news, and then folks reach out to the hotline as a resource to them at that time. Also May is Maternal Mental Health Month. So, around our anniversary, certainly we saw upticks, but at this time I can't comment on that more than because we've been just in operation a little over a year.
Yep. Thank you very much
for the question.
I see a really great comment in the chat about we need more trained mental health professionals with this specialty. Any thoughts about sending these resources to CACREP counseling, psychology services, programs to tweak for the interests of graduate students? Absolutely. And that's like a great example of ways that you can take the resources and get them into diverse audiences. So again, not only for women and families, but those mental health professionals that are practicing or the ones that are students in the process of learning. We want to make sure, and I fully agree, there's not a lot of folks that are trained in this specialty area. So as much as we can get resources into the hands of professionals as well, that's going to really help us round out, from beginning to end, being able to provide quality services.
Did find one here. Are there videos in Spanish or translate to be used to share with other groups or other translations? And Danielle, would you like to answer that?
Sure. Yeah. So at this time, we have all of the videos have captioning that's available in Spanish. So if you're in YouTube and you select the caption option, it will give you an English caption version and a Spanish caption version. And then all of the print resources have a Spanish downloadable version as well. That's another piece that we would love to receive feedback on. If there is a specific population that you all work with that there's a need for the resources to be translated into additional language, please let us know about that as well. And we will take that into consideration with our next steps in planning.
I think another one was also related, or I've seen a couple related to demographics and, some of the areas that we've already talked about, potentially expanding populations with Native American populations, or as you mentioned before, infant loss or miscarriage. I can actually hop in and answer that one. Actually, I have not introduced myself. Hi, everyone. Michelle Bowling. I'm the Director of Strategic Communications for the Office of Women's Health, and I know we have 1 minute left. Those issues, yes, we are absolutely thinking about how we can expand, whether it's, broader information about mental health conditions beyond PPD, and again, linking to resources that are broad, making sure that we are integrating different populations into the information that we have and some of the examples that we're showing. So that's one of the important reasons that we would love your feedback and make sure that as we go through this year, we're continually evolving.
Absolutely. Thank you for that, Michelle. So we're just about to time here. I know there's still so many great questions in the chat and in the Q&A. So we encourage you all, please follow up with us to continue the conversation. Like I said, we will send out the recording and the slides that will have Dr. English and Dawn's contact information, and you can reach us at our women's health at hhs.gov, or reach out to myself or Michelle. Either way, we will help you find the person that you want to talk to in terms of developing next steps in collaboration. So thank you all so much for your time and attention, and we really look forward to working with you all in the future. Have a great day.